Nursing is one of the most trusted and respected professions in the healthcare industry, and nurses play a crucial role in the treatment and care of the sick, injured, disabled, and dying. They are actively involved in multiple activities in the healthcare field, including research, management, and patient advocacy and care. It's no doubt that nurses are an essential part of our society, and in this video we're going to briefly explore their elaborate history and beginnings. The first documentations of nursing as a profession are believed to be written in approximately 300 AD by the Romans. They sought to place a hospital in each town that they ruled, where nurses would work alongside doctors to assist inpatient medical care. The accomplishment of this helped push nursing on a more global scale. However, the profession became much more popularized in Europe during the Middle Ages. During this time, the nursing industry was largely based on religion, with most of the nurses consisting of nuns or even monks. However, it was also during the Middle Ages that many advancements and innovations took place, and eventually formed the base of modern nursing. The first Spanish hospital was built in the late 500s to early 600s in Merida, Spain, with the intent to care for any sick individuals regardless of ethnic origin or religion. During the dawn of the 10th and 11th centuries, nursing began to really expand and grow, and this was primarily due to changes in ruling in Europe. The effects were resounding. For one, monasteries started to house hospitals inside their premises, as well as a separate infirmary. Within these monasteries, nurses provided patients with any type of service that the patient required, even outside of the general health care services. This model of caring became increasingly popular and provides a general outline for all nurses on how they should treat patients. In the 17th century, the presence of nursing began to diminish, mostly because of a lot of monasteries and hospitals being taken down. However, that didn't mean that nurses just disappeared. In fact, many of them developed new skills by working alongside other doctors, surgeons, and physicians at different estates. Although this was a dip in the history of nursing, it paved the way for modern nursing, which began with a woman named Florence Nightingale. Traditionally, many people regard Florence Nightingale as the beginning of professional nursing. Nightingale was a well-educated daughter of wealthy British parents, but decided to become a nurse and break social conventions. She believed that well-educated women using scientific principles and informed education about healthy lifestyles could dramatically improve the care of sick patients. She also had the belief that nursing was an ideal option for women seeking intellectual and social freedom. During the 19th and 20th century, nursing was becoming more important than ever. There were all sorts of wars and sicknesses raging on, from the Crimean War to the Civil War. Nurses were sent to care for the sick and wounded. During the Crimean War, in 1854, the British government asked Nightingale to take a small group of nurses to a military hospital in Turkey. Nightingale had a chance to prove her beliefs. Within a few weeks of hard work and cleaning, the death rate plummeted. Soldiers were no longer sickened by infectious diseases arising from poor sanitary conditions. Within months, the public nicknamed Nightingale as the Lady with the Lamp, and by the end of the 19th century, the entire Western world shared her belief in the worth of educated nurses. Nightingale's achievements overshadowed previous nursing practices and provided new light on some previous problems. Before, nursing was mostly done by family members, friends, or more educated individuals in the community. During epidemics, men took over. Those without family or friends to care for them would usually end up in hospitals. However, hospitals had varying degrees of effectiveness. Some had outstanding care, while the situation in others were deplorable. The unreliability of hospital-based nursing became a particularly terrible problem in the late 19th century, and this, along with a plethora of other factors, led to a new healthcare profession, the trained nurse. Hospitals began to provide training for nurses. Students would exchange lectures and clinical instructions for 2 to 3 years of unpaid nursing care. This model had a few holes and long-term implications. For one, there was segregation within these hospitals before, but now with the education modules in place, it reinforced the barring of African Americans from training. Also, this hospital training model strengthened the stereotype that nursing was a women's job. Only a few hospitals provided training for men. Despite that, these additional educational measures proved to have a huge transformation to hospitals. Nurses were now not only compassionate, but also highly skilled. They administered increasingly complicated treatments and medication regimens. With training in place, routines were established, and a systemized environment was created. Outside of hospitals, nurses quickly played a crucial role in the fight against infectious diseases. They cared for those that were sick, and especially poorer families or immigrants, who may not be able to afford hospital care. As well, the two major world wars also saw the need for an abundant number of competent and strong nurses. Although changes in healthcare systems have re-emphasized care at home, by the mid-1950s, hospitals were the largest single employer of registered nurses. However, despite the trend continuing, many nurses also became involved in outpatient clinics, home care, and public health, as well as other community-based healthcare organizations. In the second half of the 1900s, important changes began to occur. The nursing profession became more diverse. The American Nurses Association, otherwise known as ANA, which was founded in 1896, desegregated in 1949, one of the first national professional associations to do so. Although this was a major step, the National Black Nurses Association, NBNA, formed in 1971 to address some key issues that the ANA couldn't deal with. The educational structure of nursing schools also saw a change. Hospital-based training shifted to collegiate programs in colleges and universities. In addition, there were now more options for programs and education, for example, roles as clinical specialists or nurse practitioners. They could specialize in a multitude of different areas as a nurse, and by the 1970s, nurses were establishing their own doctoral programs. In the 21st century, we've continued to see the rise of nurses. There are more options now than ever if you decide to pursue a career in nursing. The industry is constantly evolving and experimenting with new models and types of patient care. The nursing profession is also strengthened by its increasing emphasis on national and international work, and supported by multiple large organizations, the most notable being the World Health Organization. To sum it up with words from the WHO, nursing is the backbone of most healthcare systems around the world. It has played an immense part in the healthcare field by caring for all sorts of patients, whether they be sick family members or injured soldiers back from war. From the Romans in the year 300, to Florence Nightingale, who traditionally started modern nursing, to the 21st century, where nurses work in the front lines against infectious diseases like COVID-19, nurses have always been a crucial part of our society and environment, and our healthcare system wouldn't ever be the same without them. That's all for this video. Of course, this is definitely not comprehensive, and the history of nursing is much more thorough and fascinating than what I have outlined here, but I do hope that it has opened your mind to how nursing has come to be. I'd love to hear from you on your thoughts on nursing, or any questions that you may have. Thank you all for watching.